welcome to another episode of Coffee Talk with Encore. Today, our focus is on talking about the benefits of group therapy with an emphasis on how speech therapists can include group therapy within their treatment sessions. Today, we are thrilled to have Jan Ward joining us for our Coffee Talk discussion. Now, Jan, she's a senior vice president with Encore and also happens to be a speech language pathologist. Jan, thanks so much for being here with us today, and we are really looking forward to hearing your thoughts on the benefits of group therapy and how speech therapists can incorporate group therapy into their treatment interventions.
Thank you, Kathy. I am just so excited to be here today and discuss group therapy because of all of the benefits that group therapy provides to our residents. As human beings, we tend to be social creatures, and being around others that maybe are doing the same things that you are doing can help you feel more motivated. When you and that partner are encouraging each other, you often work harder and get better results. That's a good thing. And there's nothing wrong with a little friendly competition. I think it's easier also to maybe try new things when you have a partner, and you may actually just find that it's easier to participate in some of those tasks that you are working with one-on-one with a peer. It feels more fun and less like actual therapy.
And that's when I'm a huge fan of group. I'll start off by saying that I think that it's wonderful. I've seen good outcomes with my patients, but not only outcomes during therapy, kind of those outcomes long-term too, right? Like those I guess, tasks and things and skills that they're picking up during the group tend to kind of stick a little bit longer, after they're discharged. So that's a good thing too. Because of all these great things with group, we want to make it as easy as possible for our therapists to do group, right? Because like we said, it's great for the patients. But we've noticed with speech therapy that Ashley on our team has gotten quite a few questions lately regarding speech therapy groups. So Ashley, what are some of the things that you're kind of seeing with these speech therapy groups?
Yeah, that's very true. Just the logistics of the group planning process can sometimes be overwhelming. I get a lot of questions from speech therapists asking if they can do dysphagia groups with the code that PT and OT typically use for group therapy. So that 97150 code, and it is really specific. And it depends on what the LCD says. So I'm constantly looking up codes and trying to troubleshoot what types of group are covered for specific regions and buildings, and making sure that, whatever type of group the speech therapist wants to do around the country, just based on that information. So not only ensuring the appropriate code is on our treatment plan, but if they're not, making sure that we're completing a recert in a timely manner to get that CPT code on the treatment plan so we can utilize that code. And then really just kind of differentiating between payer sources. So knowing the difference of group stances from Medicare A to Medicare B, and how those treatment sessions can vary based on their group guidelines. So, Jan, I want to pass it off to you. Have you seen any other areas that speech therapists in your regions are kind of struggling with?
I do. And I think what you talked about with the coding is probably the top question, and understanding that 92508 is a treatment for communication, voice, language, speech, or auditory processing. It does not include dysphagia. And as you said, not all of our LCDs allow that code. So it's important to know what your LCD states. Another area that I see individuals struggle with as a clinician, deciding who should participate in a group. As a clinician, as a speech language pathologist, we should consider each individual person. And as you are developing that plan of care, consider the impact of how that group setting would improve the person's ability to meet the goals that you've established. Our group should be designed to accomplish specific functional outcomes. If we are indeed able to do dysphagia groups, as a person that may be on a puree diet, I think it would be a really nice thing to be able to sit with another peer and work on some of those same tasks, exercises, compensatory strategies that we are working on so that we can improve our swallowing function.
I agree. I always tell other therapists that I work with, whether it's a CF or a grad student, that I just feel like magical things happen in dining rooms when we get multiple patients together to have a meal and make it a social event, or even in a group therapy session. So kind of like you said, Jan, I think it's really important that we're intentionally choosing whatever therapeutic activities we have for our groups, so that they are promoting meaningful interactions, because that is the purpose of the group. So I always recommend that, you're prepping your group ahead of time. So whether you're gathering the items for a new group, maybe you have decided to make a group kit for a particular topic. I think that those are really great to have. Make sure that your schedule or your patients are scheduled appropriately, informing all of the floor staff that you're doing a group at a certain time. So maybe your patients can be up and ready. Maybe pair them, after their PT and OT session, and just kind of invite them over to a different area of a gym for a group. I had a wonderful coda in a building that I worked with. She would actually go around and create an actual invitation and give it to all the participants in our groups for that day. And they felt, kind of honored and really excited that they were kind of invited to a special event that afternoon. So those higher level patients that are a little bit more ambulatory, or they are working on their wheelchair mobility, maybe they can bring themselves down to the gym or wherever the group area is. So I think that, incorporating and kind of planning that accordingly to take less of the burden off of, you as a therapist running around the building like a mad person trying to gather for patients. We want to make sure that we're addressing our goals. So like I said, even if the activity is, needing to be less complex for a participant and then more complex for another participant, you can still have them working in the same group. So like I said, that peer modeling and just that social interaction is really, really powerful. And another thing that I wanted to point out, because we do have some OTs on the call, that my favorite thing to do as a speech therapist is actually pull OTs in to a group. So whether you are, starting off a speech group by going over, a recipe, sequencing, problem solving for how you're going to execute a task, and then OT comes in, swoops them up, and they go into the kitchen and they make whatever said item you have set up for them. So I think really kind of interacting with other disciplines is a really powerful tool that we can use too.
That sounds like a fun day.
Sign me up.
Oh my gosh. And those really are fun ideas. Absolutely. I think that, collaborating and working with other team members, it can not only be fun, but it just really enhances that experience for the patients that we're working with. Just like you said, Ashley, we just want to make sure that as we're doing these fun groups, we really want to be mindful of the fact that we absolutely have to make sure that we're staying within the plan of care and that we are working on specific, goals that are pertinent to our patients. So as we wrap things up today, I really once again want to thank Jan Ward for joining us on today's Coffee Talk with Encore. And thank you to everyone else who's listening in on our discussion on ways in which we can incorporate groups into speech therapy treatments. Well, we look forward to having you tune in again on our next episode of Coffee Talk with Encore.